Good afternoon, everyone. My topic is over-the-counter eye drops. The term over-the-counter eye drops does not have much significance in India since many of the drugs are available without prescription on demand by patients at the pharmacy. Even though there are many laws and regulations prohibiting the practice of dispensing of prescription drops without prescription, the practice is still rampant. Almost every prescription drug is available without a doctor's prescription all over the country. In India, laws which regulate this are not as stringently as imposed as in other countries such as United States. So these are the different complaints with which the patients visit a pharmacy, like redness, itching, pain, watering, foreign body sensation, and trauma. These are the most popular over-the-counter eye drops, like antibiotic and steroid combinations, antibiotics, steroids, sometimes decongestants, and also lubricants. Decongestants, antihistamines, and lubricants are the eye drops which have been approved for the OTC use. Recently, even chloramphenicol has been approved. Other available ocular medications are prescription eye drops. So here are a few cases which we have seen in our center. The first case is, it is a 42 years female who has come to us with eye pain and loss of vision in both the eyes from 2 days. She has been using steroid and antibiotic drops from 6 months, which is obtained from a pharmacist without any checkup. On the day of examination, the best corrected visual acuity was 6/60 in both the eyes with IOP of 38 and 40 millimeters of mercury. When we have done a slit lamp examination, there was corneal haze and the angles were closed. A second case is of again a 42 years female with blurring of vision in left eye from 2 months. She has been using steroid eye drops twice daily from about a year, and her best corrected visual acuity was 2/60. And on slit lamp examination, we found posterior subcapsular cataract. Then we have a 34 years male who has come to us with pain, redness, and discharge in right eye since 2 months. He has been using steroid eye drops and antibiotics with the advice of a pharmacist, and when we have examined, there was herpetic keratitis. In the last case, it's 46 years male with severe pain, redness in left eye since 1 month. He has used some drops suggested by the pharmacist. Then the pain and redness has resolved, but he slowly developed some gradual vision loss. On slit lamp examination, we could see anterior uveitis with vitritis. So these are the differential diagnosis for a acute red eye presentation, which we encounter regularly in our practice. We have studied in about 1 to 1.5 months that in about 100 patients who have complained with redness, their first visit was to pharmacy is about 46%, and the complication rate was 22%. About 100 patients in whom they have visited with watering, 63% of them, and the complication rate was only 2%. Whereas 100 patients with itching and foreign body sensation, their first visit was to pharmacy is about 58%. And the complication rate is 12%. And with pain, 54% of the patients first visited a pharmacy, and the complication rate was about 24%. So as we know, the most common complications of corticosteroids, like steroid-induced glaucoma, cataract formations, delayed wound healing, and increased susceptibility to infections. But there are also certain complications with other types of OTC drugs, like antibiotics can have drug resistance, corneal and conjunctival toxicities, itching and dryness. Decongestants themselves can cause different forms of conjunctivitis. Lubricants sometimes can cause corneal and conjunctival toxicity, loss of natural tears, and may increase dryness. So the Pharmacy Act of 1948 regulates pharmacy practices in India. Pharmacists are expected to be careful and cautious while dispensing medicines to the consumers. They're expected to educate the customers about intake and effects of the drug. Unfortunately, in India, most of the chemists are themselves not knowledgeable enough to educate the consumers about OTC drugs. They neither insist on a prescription for a prescription drug nor question the customer about the need for a particular drug. So what are the motivating factors for this OTC usage? That is easy availability of wide range of prescription drugs without prescriptions, low medical literacy among the populations, advertising by the pharmacist, and desire to reduce the cost of healthcare. Many of them think if we go to the doctor, they'll suggest us some investigations, and it is a waste of time and waste of money. So these are the different studies which have supported that we are not supposed to use the over-the-counter eye drops. In India, there was a study showing that 99.1% of the people lack knowledge about 2 types of ophthalmic preparations, that is prescription-only drugs. And they have reported about 3 cases of total vision loss. There are also similar studies in Saudi Arabia, and Suparkar and co-workers also describe different patterns of conjunctivitis by ophthalmic decongestants. There is also a study in Bengal saying that the habit of misusing steroid medications through self-medication, it can lead to complications in eyes. So what are we worried about? The most important thing is, yes, complication rate, glaucomas, maybe increased susceptibility to infections. And if you think commercially, even I have seen multiple patients who are saying that we went to a pharmacist, they have given us drops, the redness has reduced within 1 day. But you're giving us treatment since 1 week, but it is reducing slowly, not instantly. Maybe that person has described some phenylephrine plus tropicamide combination and there was blanching of the conjunctiva. So what should we do? One thing is awareness in the public and education to the pharmacist. Pharmacists themselves should be enough knowledgeable to educate the patients so that they don't give away the prescription drugs without prescription. Thank you.